afternoon, everyone, and welcome back to the Brainy Boomer Lecture Series. We're so very happy you've all joined us today. In 2007, the McGill University Research Center for Studies in Aging, or the MCSH Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSH Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of their needs; to enhance the positive image of the aging process by addressing stereotypes and myths about aging; and finally, the dissemination of research on aging. Dr. Lorraine Mazzella-Maiolo is a family physician in Montreal. She is a medical advisor member of the Education Committee of the McGill University Research Center for Studies in Aging. She is an associate professor of McGill University in family medicine. Among her activities, she is a physician at the Centre d'Hébergement Henri Bradet, Richardson Hospital, Manoir Claudette Paris, and has extensive geriatric expertise. Before continuing, we would like to remind you to please mute your microphone on Zoom, and that if you have any questions, you could just wait until the end of the conference, or you could write them down in the chat box on Zoom. And now I'd like to invite Dr. Mazzella-Maiolo to start her presentation.
Thank you very much for that lovely intro, Caitlin. It's very nice to be here again. It's my first video Zoom call with the center. We do lots of calls in person pre-COVID times, but things are changing. So we're going to have a little talk about depression in the time of COVID. Now it doesn't want to move. Ah, there we go. I have no disclosures or conflicts. I'm not getting paid for this. Yes, we're all at home or have to be at home. Maybe on Sunday we'll turn to orange, which will be good. Depression. We're going to talk about depression, which affects about 1 in 15 adults in any given year, 6.7% of the population. And 1 in 6 people, 16%, will experience depression at some time in their life. And that could be from 16 to 50% in some studies. Depression can occur at any time, but on average, it first appears during the late teens and mid-20s. And my own experience anecdotally is I see more and more 30 and 40 and 40 years old, but I'm seeing more and more men, even though here it says women are more likely to experience depression. But especially this year, I am finding more men are experiencing depression, but that's anecdotally in my own practice. There's a high degree of familial and first degree relatives with depression. So you have a genetic component maybe, or maybe an environmental component, because that's the way they act in the house. They're a depressive parent and they pass their mood and the way of acting towards certain circumstances to their children. So it can go up to 40%. Sad, I've got to get rid of this. There's something here, okay. Sadness is a normal part of life, and so is anxiousness. I want him, by the way. Depression, and what I'm talking about today, is major depressive disorder. I'm not talking about bipolar. I'm not talking about other endogenous forms. I'm talking about major depressive disorders, which are common and serious medical illness, just as diabetes or heart disease or kidney problems are. It's serious medical illness. Unfortunately, sometimes it gets a stigma around it, but it's the same exact thing as any other of our medical diseases. And it makes us feel negative, and it controls the way we think and we act. The current coronavirus pandemic is particular and rare situation to our generation. Now, the reactions that we are having now are for us. But if you look back at past pandemics in history, or after a serious event like the end of a war, or during a war, or during a tsunami, or what they're feeling, the feelings are exactly the same. So we're experiencing this in our generation, but it has occurred before. And humans, we all have the same response. It can affect people physically. Our psychological health can affect our physical health. You all see these pictures of the healthcare workers. There's a measure of a measure of change reflects in as anxiety, depression, work productivity. Our optimism goes down. We feel isolated. We feel there's a threat of financial risk, and we have psychological health problems. What we do have when we have depression, depression must be a mental disorder of at least 2 weeks, because you can feel sad because you lost your wallet, or you lost someone died, or something bad happened to your car. You could be sad, but this is not reactional. This is longer. You have a pervasive long mood that dominates your life. You have low self-esteem. You have feelings of worthlessness and hopelessness. You have loss of interest in normal activities that usually you enjoy. You don't want to play tennis. You don't want to go for a walk. You want to stay inside. You have low energy, maybe low. You feel tired all the time. I have no energy. I don't want to do anything. You can feel anxious, and we'll talk about this a little later. And you can feel irritable. You could just be an old grouch. I mean, that can just be increased grouchiness and irritability and always feeling on edge. That can be a sign of depression. You can have a change in appetite. You can be increased, or some people eat less. During COVID, there's the 8 to 15 pounds that we call the COVID pounds because of decreased physical activity. That's not part of the depression. That's kind of normal because we stood inside and we baked. But there could be an increase in weight. There may be a sleep disorder. You may be sleeping more. Instead of sleeping 8 hours, you may be sleeping 10 hours because you're home and because you're sad. But with the major depressive, you sleep more and it's pathological. You could stay in bed the whole day. Or you might sleep less and have insomnia. And that's a very important characteristic of depression in having insomnia, is because if you don't get your rest, everything cascades down the hill and gets worse. So when someone has a major depressive disorder, we always try to help them get their rest. You may have suicidal thoughts. You may have suicidal ideation, but just because you have a suicidal thought does not mean that you will carry them out. And all suicidal thoughts and ideations are taken seriously, but they have to be explored. Occasionally, there may be delusions or hallucinations. I had one lady who had a major depressive disorder, and the main symptom is that she thought she poisoned her family with food, a chicken, and she was convinced that she poisoned her family with chicken. And then we went to we did scales on her, and we checked her, and she was major depressed, and we gave her medication, and then this was 20 years ago, and now she's fine. I mean, she healed after about 2 years. Major depression is more severe and lasts longer than sadness. Like I said, sadness could be, it is a normal reaction to life, and it is normal. This says, your stress level is high, follow me to the lab. And then you see she brought it to the lab. I want that. So how do we diagnose depression? Well, we do mental status exams. We have a series of many scales that we can go through. There's the PHQ, or the Hamilton scale for depression. And what they do is they ask a series of questions. Do you feel lonely, worthless, helpless? And they grade it to sometimes, always, or to never. So there's about 5 grades between there. And with that, hopelessness, and we'll go through that, loss of interest, loss of appetite, insomnia, and goes through that. Then, of course, you're going to need a physical exam to make sure that you don't have atrial fibrillation, or you don't have thyroid disease, feel a nodule or something, or you don't have a pneumonia hiding that's making you depressed, because sometimes occult illness can make you feel sad or depressed. Of course, we're going to do blood tests to check your thyroid, to check your vitamin levels, to check if you're not anemic, because if you're anemic, you're tired all the time, and you can have feelings that mimic depression. And very often when you're depressed, we do get a cranial CT scan just to make sure you don't have another pathology in your brain, maybe a tumor pushing on it, infection, who knows. Okay, the risk factors for depression can be genetics. Depression can run in families, like I said, 40%. It's not necessarily going to be that if you have a depressive parent, you will be depressed, but there is a percentage. There's 60% that you won't, But again, these percentages depend always, and everything I'm speaking about today, these percentages reflect different studies, and there's a wide range of percentages. So it's very difficult to pinpoint that this is exactly 40%. It's very difficult. But environmental factors can predispose one to depression. Poverty, violence, prolonged violence in the home, social and familial abuse, and trauma that was for the person can be one of the risk factors of depression. We see that right now during COVID, family abuse is up 300%, which is a statistic which is remarkable. Medications can cause depression. Beta blockers are notorious for this, but we need to take them. So thank goodness there are newer beta blockers, because sometimes you must take one, that do not predispose to depression, but a lot of them do. The newer ones don't. Many anti-cancer drugs do that. Contraceptive, the oral contraceptive, the IUD, progesterone pills, the subcute contraceptive, the progesterones, they can all cause depression. So many of the medications that we give for prostate cancer, they also can do that. Depression can affect everyone, anyone, even those who appear to have an idyllic life. I mean, if you're the rich and famous, if you have the perfect house with the picket fence, you have everything you want, the beautiful car, you have a beautiful family, you have a family that's intact, you have a family with no divorce, you have a family that, everyone gets along, no one. And in 35 years of practice, I have to say, I don't see one family that is that. Everyone has something going on. And depression can hit even the rich and famous and everyone else. Depression, the good news is that it's very treatable, and it's the most treatable form of mental illness. About 80 to 90% of the people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Now, what that means is that most people get better from a depression. Some people do not, and they have recurrent depressions. But even with those who have a depression later on, when they are depressed, we can relieve some of the symptoms. We may be able to relieve the insomnia or the feelings of anxiety. So there is a good news that most people do get better. Now, I'm just talking a little bit about the COVID depression, which is a little bit special because it's a reactional depression to this situation. Since March of 2020, and this is from the Health Officer of Canada, 1 in 5, or 21% of Canadians screened positive. Now, this is a subjective study. They sent out questionnaires, and 1 in 5 said that they were depressed, anxious, and had some sort of form of post-traumatic stress disorder because of the pandemic. Mainly, these positive cases were in cases or in people who already were at risk. And we'll talk about that being healthcare workers, marginalized groups, and poor socioeconomic status. And remember, these are statistics, and no statistics yet are known yet because it's going to take 10 years or 5 years before we can look back completely at COVID, because these are very preliminary things that we're looking at, and they're really questionnaires at this point, and long-term studies haven't been done, just like we haven't done long-term studies on our vaccines yet. Yet we're using them, so we're using these statistics. The groups most at risk, again, I'll repeat it, are healthcare workers. Why are they at risk? Because especially at the beginning, they were being burnt out, and they are still being burnt out. Well, number one, because they had lacked at the beginning PPE, protective equipment, and you were reusing masks, and you didn't have enough protection, and they had fear of getting the disease themselves and bringing it home to their family. Now, you do that one day, fine, but if you're doing it for a month, 2 months, 3 months, 6 months, 12 months, you're playing Russian roulette. And they feel finally the CEOs got together and the governments got together and prepared us with these, with our PPEs, so we feel more at ease of going into our hospitals and caring for people. So healthcare workers were getting really burnt out for that, and that's why they were at risk. Marginalized groups, well, yes, of course. And the elderly also were groups at risk. Low socioeconomic levels, of course, if you have to worry about where your next meal is coming from, we also have the marginalized groups of drug users and the homeless. So why do we feel these feelings? Well, because of loneliness or isolation. We were all told, off the street, in your house. We may have lost our job or income loss. Even with the subsidy, it may not have been the same, or it might have been better, but there is always an uncertainty. But if I go back, will my job still be there? If they say I can do it from home, maybe they don't need me as much. There's difficulty in meeting financial obligations and essential needs. And there's uncertainty about the future because everyone said, when will this end? And of course, we also had the conflict of not having the news given to us, and governments telling us one thing today, another thing tomorrow, and keep changing. And it wasn't that the governments and healthcare and the CDC and the Canadian Health Office were trying to not give us the correct information. They didn't know. So they gave what they had when they had it. And that uncertainty, well, now today you say we don't wear a mask, tomorrow we wear a mask. What are you talking about? Can't you make up your mind? No, we couldn't, because we only had a certain amount of information. And that constant change back and forth made us feel insecure because our government was insecure. It's like when your father changes his mind, make up your mind. I'm not feeling secure in my own family. So that was the information we had at the time, and that's what we had to work with. So continuing, how do these act out in us? We have low concentration, irritability, aggression. We can cry, we have withdrawal, difficulty making decisions, increased use of alcohol and drugs or other medication or other over-the-counter medications, etc. I mean, alcohol increase in the use of cannabis, alcohol and cannabis increased tremendously. General population trends. Well, did they increase or decrease? Well, like I said, the numbers were already on the rise pre-COVID for depressions, and large-scale studies suggest the trend needs to be strengthened. Like I said, the vulnerable populations already at risk are taking the brunt of it, the low income, the marginalized groups, single or divorced, they always get the brunt of anything that happens in society. Speaking of suicides, okay, we really have to be careful with the media reporting. When I was preparing for this talk, I was quite surprised from what I was reading in the medical journals and what I was hearing on the TV.
I'm not seeing it. So maybe
I'm sorry. Yeah, thank you. What I was hearing on the TV is that they're on the rise, and then I'm reading that they're not on the rise. According to some investigators, there have been a reduction in suicide since the beginning of this pandemic. And why is that? Because there's more support. The people who were feeling isolated and alone before may be now in a community that is giving them the support they need. And also because there are programs out there, and were very well advertised, that there are suicide helplines. I find that a lot of people were reaching out for psychological support during the pandemic. So this may be one of the factors to reduce it. And I was glad to hear that, but we cannot always listen to what the media is telling us because they want to sensationalize. So suicides did decrease during the first months of the pandemic. We're still waiting to see what happens now. And it was stable for the rest of the year. So like I said, it's early to find out what is definitive or not, so research is needed. But I thought that was extremely interesting because that very night I hear on the news, they're increased. And then I'm reading an article published a couple of days before saying they're on the decrease. So it was difficult. So everything is in relation to something else. And then there's a challenge for mental health. So for people who have had the disease, and we have something called post-COVID syndrome, where you have mental health issues. You have, after being in COVID, after having COVID and being in quarantine, there may be a stigma to it. I've had patients who did not want to go onto the app and report that they had it because she felt that there was a stigma to being, that she had COVID. And people treated her like a pariah if they knew, oh, stay away from me, you're going to give me COVID, even though she was like 3 weeks after. So she is no longer shedding. Social distancing may make us fearful or being threatened by this virus. So is it the pandemic that is causing the depression in post-COVID patients? Or it is the virus doing something to our endothelial linings, making us feel more depressed? Is it knocking out our endorphins? Is it increasing our bradykinins? We don't know yet. So it could be a confluence of factors affecting the patients. And of course, every patient is individual and we need a patient-by-patient approach. According to Statistics Canada, that's what CHMH, Statistics Canada Mental Health in Canada, the data collection is going on and it's fundamental that we do it. They use the screening tools like I measured, the major depressive disorder, generalized anxiety disorder, and post-traumatic stress disorder. We have these SATI faces, we have the PHQ, we have the anxiety scales that they use. Okay, I just wanted to speak a little bit about anxiety because it's a natural response to perceived threats, expectation, uncertainties. Am I going to pass this exam? Have I studied enough? Is my son going to get home on time? Is everything going? That's normal. It's normal. But our anxiety here is always on because when is it going to stop? I think in my practice, people said, oh, now we're opening up. When is it going to be over, doctor? I said, it may not be over. Way back in March, they would say, oh, the second wave will come and then it'll be better. And I said, well, at that time, we were being told by the scholarly professors that there may be a third, fourth, fifth, and sixth wave. And sure enough, we're in 4 waves so far. So it may, let's hope, but it may come back again once we're back inside. We don't know. So they tell us to stay at home, stop the spread, stay at home. And then we have to hear that this is the new normal because we want to go back to the way it was before. But we're knowing, oh, well, may not go back to the way it was before. And that might cause that change of our routine, may cause us to become depressed or anxious. So we have symptoms, psychological and emotional. And I put this slide up to show that some people say, oh, we're all in the same boat. We're not all in the same boat. We're in the same storm, but everybody's in a different boat. Some people have a stronger support system than others. Some people have a really nice yacht to get through this, and some people have an inflatable raft. So it depends what you have to get through this. And we try to help those who cannot get through it. We're in the same storm, not the same boat. So what can be done? How are they treated? Well, psychotherapy and support therapy are very important. Sometimes just talking it through with your health professional, with your doctor, with the nurse, with the social worker, with your psychologist. They're very helpful because when you're speaking with people who have techniques to help us to absorb information and cope with it, it is very helpful. And many times we don't need medication. Sometimes we do. We need to use the SSRIs or medications for antidepressant, for depression, or for medications that are anxiolytics. We do have to use that. On longer term, we use, if it's a prolonged depression, we use something called cognitive behavioral therapy, which makes us realize the triggers that we have that make us feel sad, make us feel depressed, make us feel lonely. So there are things that we can do. We say, when I come in contact with this situation, I know I should not feel that it's my fault or guilt or anything that has to do with that. So that is very helpful. And that's usually a long-term therapy. If you feel depressed or you think you may be, reach out to your doctor, to your nurse, to the CLSC, and avoid self-medicating with alcohol and over-the-counter drugs. Like I said, it's first thing we go for is something that's very readily available. Depression is real and we can treat it. So what do we do during COVID to help us stay healthy mentally? Avoid sensational news channels. Watch the first 10 minutes and then turn it off if they're going to be talking for the next half hour about it. Wait till they go online. You're online with me now. Go online and just watch the sports part or the part that living that you like. Leave out that part because constant battering down of this information makes us feel like the end of the world is here, and it's really not. It's terrible, yes, I'm saying no, but too much can actually wear down on our coping mechanism. Avoid watching the continuous coverage of the pandemic. Now, I was watching it all the time too. We wanted to know what was going on at the beginning. Avoid too much TV, internet, or social media. And then I'm going to go later and say use it. We can numb our brains. Yes, we can. Go outside and move. If you can go outside, go. Talk to your friends and family. That's really important. With the isolation that happened at the beginning months was very difficult, especially for the elderly. I know elderly people who didn't even go out into the sidewalk. They stayed in their, well, I don't know what's going on there. They stayed in their house. They didn't even go out onto the sidewalk. So try to go out and speak to people if you can. Now that we are in an orange zone soon, it should be a little easier. Eat healthy. I mean, its tendency to go towards the carbs has come from food and giving off serotonin. It's always very easy. So eat healthy. Practice physical distancing, but stay socially integrated. And use judicious use of email, phone calls, video chats, and social media. So use it judiciously. Yeah. What's happening? Okay. Okay, and oops, went too far. Okay, and practice mindfulness because if we realize where we are, and this buzzword of the year is mindfulness, do stretching exercises to move your body. And if you cannot walk, you're in a wheelchair or something, that just do your upper limbs as far as you can, or your lower limbs. You go to the point that you can, you don't have to be um, a contortionist to do that. Meditate, think about things. Close your eyes and relax. Take big breaths. Breathe in through your nose and out through your mouth slowly. And that will help to release anxiety. Pray. If you have faith, it's a wonderful thing. And praying is a big part of life. Practice gratitude. This one I like a lot because when we are seeing everything negative, I find that just some people say 5, I say 3 because it's hard, to think of 3. And what are 3 things you're going to be thankful for? Well, big things. I don't have COVID, or I eat well, or whatever. But even it can be as simple as, listen, I'm grateful that there's leaves on the trees. Finally, we're in the summer and we have these beautiful leaves to look at. Or little things. And those little things, if you really appreciate the little things, the bigger things come with it. Okay. And accept that things I do not think will go back to the same way they were. Accept the new normal. And I say, be a willow and not the oak. The oak in a storm will break. Be the willow and bend. So we have to bend. We have to change. As a physician, it was very difficult to do telemedicine at the beginning. I'm getting used to it. And I don't think we'll ever go back to the days where you have 10 people waiting in the waiting room. I don't think that will happen anymore. But we'll get used to it and we'll have to adjust. And I'm sure we'll start doing good medicine, maybe better medicine than before. And for sure, for patients, if they just need their blood results, that's good. If they need a physical exam, then they come in. So it's helpful for everyone. So remember, be the willow. And enjoy. If you need help, get help. What you could do is, like I said, call your doctor, your nurse, a psychologist, or someone in the community. We're very fortunate. We have the CLSC who does a great job for us. We have the CEOS that is really going out of its way to take care of us. So we do have a lot of resources at our hands. There's the suicide in Canada. We have the Suicide Prevention Service. This will be left on our video and anyone can pick these up. 811, you can get psychosocial consultation service. And the most important thing you can do is get vaccinated. That's going to be the best. I mean, vaccines are a fundamental tool in helping society come to a new normal. According to StatsCan, as of March 29th, and now we've even done more, statistics are always a little behind, we've done 5.2 million doses in Canada. That's pretty good. And I think we've done much more than that. I think the other day we did 77,000 doses. Larger supplies of vaccines coming in mean we can increase our second doses, and people are being called prematurely now to get the second dose sooner, which is wonderful, wonderful, wonderful news. And really, in my practice and everyone I've spoken to, doctor, can I get the vaccine? There's really very, very few reasons a person cannot take the vaccine. I've sent people who had reactions to like a Moderna arm or other serious reactions to the vaccine. I send them to the allergy clinic and they give them the vaccine there. So they're saying there are very, very few reasons we can't get them. And if you have any questions, see your doctor or contact the allergy clinics and they will make sure that you can get it or not. And very, very few. I mean, if you're immunosuppressed, that's why we give it to you, because you are immunosuppressed and you need the vaccine to build some antibodies. The reason they don't give it is if the virus is live and they don't want you to have it because you can't mount a great response to it. So these new vaccines are very good. other resources for COVID, the government of Quebec, the government of Canada, the local CIOSs, the CLSCs, the GMFs, Quebec City, the Minister of Santé and Social, Services Sociaux. They're all there for us, and they have a plethora of websites and information. And I work largely with the Italian community, and who speaks Italian, but they speak French and English. This is a referral service. If you need Meals on Wheels, if you need where to go to get these services, they will guide you where you need to go. So they're also very helpful. There are so many local groups that can help us. And I thank you for your attention, and I can take some questions if anybody wishes. So don't be afraid of the virus. I think we're looking towards the future very well, and I think we have hope. But again, it may not be as it was in 2019, but we will do a different way. Thank you.